welcome to the Sepsis training video. The purpose of this video is to ensure all healthcare workers, including doctors and nurses, can recognise sepsis better and to ensure the timely management of sepsis using the Sepsis 6 tool. There are two parts to this video. The first is a short presentation on the definition and criteria for diagnosing sepsis. The second part will demonstrate the completion of the Sepsis 6 screening tool in Meditech. It's recommended that you watch both videos. The learning objectives of this presentation are to help healthcare professionals understand the importance and burden of sepsis, to help improve the recognition of sepsis and its timely management using the Sepsis 6 tool, and lastly, improve the utilisation of Level 2 and 3 care providers. Sepsis is a common cause of death and morbidity. Approximately 123,000 cases occur in England, with approximately 37,000 deaths annually. The mortality from septic shock increases by 7.6% for each hour antibiotic therapy is delayed. Measurement of vital signs can help in determining the presence of infection and sepsis. Early identification and intervention are key to reducing mortality. Some estimate up to 10,000 deaths could be avoided. Sepsis is defined as a life-threatening organ dysfunction caused by a dysregulated host response to an infection. Sepsis starts with infection. When this infection triggers a systemic inflammatory response, this is known as uncomplicated sepsis. At this stage, it may be very difficult to recognise sepsis, as symptoms may be non-specific. However, if diagnosis is delayed, it can trigger organ dysfunction, leading to severe sepsis. When severe sepsis is associated with resistant hypotension, it constitutes septic shock. The mortality rate from severe sepsis is 35%, and from septic shock it's 50%. Sepsis is not one entity, rather a continuum. At one end there is uncomplicated sepsis, cascading to severe sepsis and septic shock. Uncomplicated sepsis requires 2 or more systemic inflammatory response criteria, plus a known or suspected infection. Severe sepsis is defined as sepsis with at least one organ dysfunction. Examples of this are shown in the slide. Septic shock comprises of severe sepsis with either persistent hypotension after 30 ml per kilo crystalloid or a lactate greater than or equal to 4 millimoles a litre. This concludes part 1 of the sepsis training video. Please now watch the second video on how to complete the Sepsis 6 screening tool in Meditech.